It's story time.
Hi everyone, welcome back to our channel. You don't want to say hi?
Oh, hi. Oh, okay.
So today's video is about our birth story. We filmed some of the parts in a hospital and at home before. But then I got into such a pain that I couldn't pick up I didn't think of picking up the phone, and someone here was sleeping most of the time when we were in the hospital during my contractions.
Oh yeah, so we stayed there for 3 days?
3 days.
Yeah.
Okay, we should probably start from the beginning.
Yeah, honey.
Good morning everyone, I hope you are doing well. So today I actually have a scheduled induction. Today marks exactly 38 weeks of my pregnancy, and my doctor decided that it'd be better for me to have an induction at 38 weeks. She talked to the high-risk specialist, and they said they were comfortable and confident to just do an induction. So that's what I'm gonna have today. I actually had to call in the labor and delivery department at 8 a.m. To see if I can still come at 10 a.m. Unfortunately, they said they are very busy right now and they don't have room for me to stay, and they don't want me to just wait in the hospital until there is a room. So they said to call back at 10 a.m. and see if they have space. If they don't, I might have to call again and might be induced later today. But either way, I think it should be today. If not, then probably tomorrow, really depending how busy they are. So I'm very excited, but at the same time very nervous. But I just want to meet our little peanut already. So I just really want to get it over with. I actually did also have to go get a COVID test 3 days ago. Since I am scheduled for the inducing, they required me to get a COVID test. So I just did that. It came back negative, even though they said it doesn't really affect actually any of the care or anything. Even if I did tested positive, it's just they would have to take more precautions. So right now I'm gonna go get some breakfast, finish up packing more things, especially like phone charger and laptop, since they did tell me to bring laptop or books to spend the time, because they said with induction it could take some time before I even get into labor and get all the contractions, so it could take up to few hours or even few days. So we're prepared for that. We are actually planning to also go to the non-stress test office today. I'm gonna be giving donuts to the nurses that have been taking care of me so well throughout the whole non-stress test appointments. I've been going there for like 2 months or even more than 2 months, so I know most of them already now. So I just want to show them that I really appreciate what they have been doing, and just want to say thank you, because they were really great and they explained everything and I just felt really comfortable. So I'll see you guys in the next one. Hello, so quick update. I just called them back at 10 a.m. And they said they are still very busy. So they actually told me to come at 4 p.m. I don't need to call, just get there at 4 p.m. If they have any new opening, they will call me earlier than 4. But if they don't, then I will just be going at 4 for the induction. Very excited. I guess I'm gonna be on my feet the whole day today, since I know I might be staying in the bed for a while, especially if I have to have all the monitoring on me, but we'll see. But definitely gonna be walking a lot and doing lots of things, so I kind of get tired as well, so I can sleep hopefully a little bit more in the hospital, since I know the contractions might not come for hours, since I'm not doing Pitocin right away. It might just start with like a balloon or a pill. So we'll see. So I will check in with you later today, hopefully while I'm on my way to the hospital. Right now I'm actually on my way to go see the nurses in the non-stress test department to drop off some of the donuts, so hopefully it will make their day. So we made it to the hospital. We checked in at 4 p.m. Right now it's 5:45. They did all my vital check and they did all my vitals check and also checked my cervix. They said I'm 1.5 centimeters dilated, right Michael, and 60% effaced. They put an IV. It looks horrible and it kind of hurts too, but it'll be fine. So I think they said they were gonna give me a pill to take first to thin out the cervix, and then a balloon as well. The midwife said it could take 24 hours or even 2 to 3 days. Hopefully it won't, because Michael over there might not be comfortable on the couch. And they have the little baby.
Don't worry, I'll go back home and sleep in the king-size bed by myself.
Hey, maybe Michael can give you a room tour later.
No.
Why not? It's actually a pretty good room, except Michael's bed doesn't look so comfortable. But anyway, waiting to get the pill so we can start this. Okay, we'll check in later. Maybe I'll be screaming later or I'll be in the bad mood. Okay, bye.
In our experience, just have your backpack. We brought duffel bags ready with change of clothes, extra socks, blah blah.
No. We need to start first that ours was planned. It was induction. It wasn't like, oh, out of the sudden we have to go to the
But
hospital.
still, have your backpacks ready.
True.
Just like if you were going for camping or a hotel for 2-3 days. But luckily for us, the hospital was just near our house, like 15 minutes. So during COVID times, they still let you go back and forth. It's not advice, but yeah, you can still do it. And our hospital was, should we name it?
If you want, sure.
Kaiser.
Very good experience with Kaiser.
Yeah.
Just even the prenatal experience and then the labor and delivery. But yeah, so to start, so we actually had a planned induction because I was actually diagnosed with the IUGR, which is like the growth restriction of the baby. So they felt like we should do an induction at 38 weeks. So it was planned for Friday, April 23rd at 10 a.m., but it got moved to 4 p.m.
Should I take?
If you
Yeah, okay. Yeah, that's
Our little princess. Since it is COVID time, I went in first to check in. And then I actually called Michael once I was all cleared and admitted to the room. Then he was able to come up, right, with all the bags and everything. So first option for me to like start the induction was.
wait. Come on, I just want to insert the parking experience they have.
Okay.
For us, they have a ballet, but the guy worked until 7 p.m. So I was like, what about midnight runs for snacks for her? And he was like, you know what? Take this ticket and park it in the delivery special parking or maternity parking. So I could park there for like 24/7, but we only stayed there for 3 days.
Yeah.
But yeah, that was good. Thanks.
I didn't know that.
Yeah.
Cool. After being admitted, they took all my vital signs and everything and then asked some questions. And then they started talking about how they're gonna start the induction, which they want to do very slowly because they wanted kind of nature ticket course, I guess, right? Because they wanted like to start it off, but they didn't want my body to kind of like.
Like nature. Okay.
You know
they
what
started
I mean.
off.
Yeah, and then my body wanted to like take off from there after it started. So they started with a pill. It was a pill, very little pill that I took, and they said that one will help.
Was that miso?
Yeah, miso something, right?
Miso something.
It's called miso. I think
we'll put the name somewhere there in her face.
I think it was to thin the cervix. And then they said usually they would also insert a balloon inside, so this I can start dilating at the same time as the cervix is like thinning. So my option was either wait until the cervix is like thinner and then get the balloon, or I could get the balloon at the same time, right? So we would like save time. They did talk about how uncomfortable the balloon is gonna be because they would basically insert the balloon and then they would put water inside and then leave it until it reaches like 4 centimeters, right? So it would like kind of come out. So the balloon, oh my god, it was so painful actually.
That's a poopy or something diaper there.
No.
What's waiting for us after this video?
I'm waiting for Michael.
Yeah, I'll find this little princess.
So yeah, they said that it's gonna be very uncomfortable, which it was very uncomfortable. I think I was holding Michael like pretty tight, right, during the balloon insertion. It was so uncomfortable. It just felt lots of pressure, and they kept like going more deeper and deeper, which I was like, oh my god, it felt so weird. But after that, after the balloon and the pill, I was able to still move around. I still had the baby monitor on me that I had to carry everywhere because she was diagnosed with the IUGR, so they had to monitor heart rate all the time. Like they couldn't just take it off. So after that, I started to get contractions, and the contractions would not go away. It would be always like,
right.
It would never go to zero. It would just stay at a certain level and then go high, and then again at a certain level, but never go to zero.
I think that was too much. So you requested to give you something to lower the contractions, right?
No, they actually said that they will have to give me Pitocin to lower the contractions, like to have them apart more because it's going too fast, and I don't think my cervix and I wasn't dilated enough for all the contractions. So they started with like 1 milliliter or something, a very small dosage of Pitocin, and it actually did help bringing it down. And what we did was I was just walking around for like an hour or two actually throughout the contractions, because they said it could also speed up the process, right? So we did like the little birthing ball, which I actually didn't bring. The hospital already had it, which was awesome. And the nurse showed us some exercises, how to do them. Oh yeah, shout out to the nurses. They were awesome in there too. Like they were really, really great.
All the shifts, all the different nurses. Yep.
Yeah, because that hospital, they had like 8-hour shifts, so we probably saw like 5 or 6 different nurses throughout the whole experience, but they were all awesome. But yes.
Did you do the ball exercise?
Well, I did it with you, do you remember, for a little bit, and then I didn't because it was kind of uncomfortable sitting on it, and I'd rather just walk around.
Would you recommend people doing it before going to the hospital, or just like a daily basis to help you?
I think it should be probably.
I'm calling her out, guys.
Yeah.
I think she should have done that. She never exercised or nothing.
No, but yeah. But it did help a little bit with the pain, but I think I prefer just walking around more for me to deal with the pain. So I think I got the Pitocin. I got the ball inside and the pill. Oh yeah, the balloon and the pill around like 6:30 p.m. and then the Pitocin probably at like 9 p.m. And I think nothing was happening until like 3 a.m. where the balloon, they checked the balloon, right? And they said, oh yeah, you're like 5 centimeters, like way past.
Yeah, that's it. Wasn't it supposed to drop down by itself when it reaches 4 centimeters?
Yeah, but it didn't. They said it was just sitting inside. So they finally take it out. I finally felt better because I still had that pressure from the balloon inside of me, and it was very uncomfortable. So after that, I was 5 centimeters and I think like 80% effaced or something. I'm not sure. And then they didn't give me anything. I think they just hurried up the Pitocin, and then I was just like in pain and contractions. And I think until 9 a.m. They said I was like 6 centimeters dilated.
We got there at 4 p.m.
Yeah, on Friday.
Yeah.
So probably like,
so we're talking about Saturday.
Yeah, Saturday, like 9 a.m. She said I was like 6 centimeters dilated. And then I think so nothing was happening around that time. Then Michael, he said he wanted to go home to grab some food and take a shower. And take a nap. So he went home around like 11:30 or something, right? And then he texted me like, hey, can I take a nap until like 1 p.m. So I was like, sure, just have your phone on ring, just in case. So he left, and I think around 12, a nurse with the midwife came in, and they said that the labor or the contractions are not going as fast because I wasn't dilated at all since 9 a.m. It was still like 6 centimeters after like 3 or 4 hours. So they recommended breaking the water. They said that with the breaking the water, there are some
risk for infection.
Yeah, risk for infection, and also the cord can come out if the baby is not down enough. So she checked and she could feel her head, so she felt very comfortable that it would be fine. If it wasn't fine, then I would have to have emergency C-section. And in that moment, I was like, Michael is not here. He's taking a nap. So I don't know if I should go with it. But then I was just like, yeah, let's just do it. So they broke my water, and it was all good, thankfully. So 6 centimeters at 12:30, they broke my water. And around 1 p.m., like 30 minutes later, my contractions got really intense, and I felt like, oh, I forgot to say about the epidural.
Yeah, you can. Epidural time.
Yeah, sorry, I forgot about epidural, yeah. So after the 9 a.m., my contractions got pretty bad, but they were still manageable. And the nurse was like, okay, if you want to get an epidural, you should get it right now, because you cannot move during the epidural procedure. You have to sit still, and if the contractions and the pain get really bad, you might not be able to get it later. So if your pain is like 6 out of 10, just get it right now, since it's still manageable. So Michael was still there. I woke him up for it. So I got the epidural. I did not want, like, I can't see it, but I was still so scared, even like thinking about it. So Michael can tell you a bit more, because you were watching the whole thing, right? How did it look like?
Well, regular stuff for me.
I don't know, because I was like, ooh. I just felt like pressure on my back when they numb it, but that's it. Like, didn't hurt that much. So after the epidural, it actually started working, but not throughout my whole body. I couldn't feel my left leg, but my right leg, I could still feel everything. And the contractions, I couldn't feel them in half of my body, but the other half on my right leg, I could really feel them intense, which was really weird. So they were like trying to up the dosage and trying to move me around, so like, you know, the gravity can play the role in it to where it goes. So yeah, so after the epidural, a few hours later, they broke my water. So going back to that. So at 1 p.m, my contractions got so bad, the epidural wasn't fully working, so I could feel all the contractions, especially on my right side. And then I felt the need to push, like, you know, when you need to kind of poop, like pushing kind of stuff. So I called the nurse and I was like, hey, my contractions are getting pretty bad and I have the need to push, and I don't know if I'm supposed to be pushing anyway. So she was like, okay, let me check how dilated you are. So remember guys, I was 6 centimeters, and then 30 minutes later, when they broke my water, I was 9 centimeters dilated. Like, it went so fast. Even the nurse was like, wow, you are like, yeah, she's like, I can't believe that you're like 9 centimeters right now. Because it was only like 30 minutes.
Yeah, and then when you called me, I woke up, I was in that wonderful nap, and you said, 9 centimeters. I'm like, what? Woke up and then boom, drove over there, because I was expecting like you would be what, 7 or 8, nothing crazy.
Yeah.
But damn, 9 centimeters that fast, yeah, that's crazy.
It was really fast. But I'm actually glad too, because the contractions were getting really bad and the epidural wasn't working. So I was really glad it was. But I was so scared Michael's not gonna make it on time, because by the time he came, they already told me to start like pushing if I need to push. So I was already like pushing at the time when he came in, but it was still like very little. And then I think around 2 p.m, right, like an hour later, I started actively like pushing. And then I was pushing for like 2 hours. And the very last few minutes of my pushing, which I didn't know would be my last.
Were you already in the delivery part?
Yeah.
Oh man, that was intense.
Yeah.
I don't know what to describe. So from my point of view, it's like you have to time everything, like just be there to support. So the partners go support your wife or your significant other.
Very important.
And yeah, just be there. Don't be, I don't know, just have clear thoughts or happy thoughts, because if you have bad thoughts, you can actually regress or go back a little bit, or I don't know, mess up the
pushing.
The timing or all that crap.
Yeah, I was so glad that Michael was really good, and I even told him like, hey, don't give me kisses, and I was just like, no, don't touch me.
I was like, okay, you can see the head. She has hair already, and I was kissing her in the forehead.
Yeah.
What was it? Don't kiss. Don't kiss me.
Yeah, don't kiss me. I was just like,
okay, she loves kisses. Okay.
It was very painful, and I was like, it was almost at the end actually of my delivery, but I was just like so tired. I was pushing for like 2 hours already, and I was in labor for like 20 hours. So I was getting really tired, and then the midwife, I remember, I think she was like also opening up my
like helping you.
Yeah.
Open
up more.
Yeah,
so
or it's just that the head would slide out
Yeah.
a little bit, and yeah, the hardest part was probably like the good pushes.
Yeah.
Like you can push, but then there are the good pushes that will actually move the baby out. So it was like the first push, hers were okay.
Yeah.
And then at the end of that first push or contraction, it was like, oh, good push, and then the second push for her, it was all good, like push. And on the third one, you were just so tired, right?
Yeah.
So like, oh, I can't do it. I'm like, yeah, it's okay.
Yeah.
I understand, like, oh. I was like, you can do it. Just like the gym when you're lifting super heavy.
Yeah, I was very happy that Marco was there, because without him, I don't know if I would be able to do it, because I was really giving up at the end, because I was in such a pain. I was like, I didn't have the energy anymore. I was like falling asleep.
Yeah.
I was telling him like, I want to sleep right now.
Wow. Yeah, that last part, oh my goodness, when she was like, Michael, I think I can't do it anymore. I was like, no. Because all the thoughts were like, she can't push her out. It's like, we have to go with C-section. Something could happen to her. I don't know, pass out, or I don't know what else, but it's like, I can't do it anymore. I'm like, no.
Yeah, but that's why, like what they said, okay, this could be your last push if you have a good push. So the very last one, when I was already giving up, I was like, okay, I'm just gonna give it everything so I don't have to push anymore. So the last pushes were like, I was trying my best, and also since she is my first child, I didn't know actually the timing and when to push. Or at the end, I figured out like, okay, the end where I'm like almost tired or like out of breath, that's when the best pushes are actually. Like that's when she's like going out more, but that's when you're the most tired already.
Also, the last one you were giving everything.
Yeah.
Because I feel like your last one is the one that, after you said I can't do it anymore, that one last push after those words, so like she came out.
Yeah, exactly.
I'm
that's
like,
why. That sounds like oof.
After the head came out, the whole body just came out without any other effort. I don't know, but it seemed like it. And oh man. She came out, I think she was crying. I don't remember anymore because I was just like...
He was emotional, I could see him crying.
I'll just say it, I cried.
Yeah, it was so cute. He was so quiet too.
Man, that sign of relief that she was still fine, she was still awake, she never passed out or anything. The baby, this little one just came out crying like crazy. Everything went well. It's like, okay, after that, it's fine. I can take care of you guys.
Yeah, he was so relieved and so emotional. And then I think they asked him to cut the yeah.
I'm like, at this point, I don't care.
Yeah.
I just want them to be fine. I'm like, okay, fine, I'll do it. And I mean, it's no biggie, but one thing is like, when I cut it, I was like, the who was delivering it?
The midwife?
Yeah, the midwife was like, it's rubbery, so you might have to cut it plenty of times. So I was like, okay, how rubbery can it be? So yeah, I cut it like 2 times, 3 times. I'm like, oh damn, it's really rubbery.
Yeah, and surprisingly, actually, people don't talk about it or don't show it that often, but delivering the placenta still actually hurt. Like, it felt like contractions still. Yeah, and I think she was like pushing on my belly to like push it down or something. So I was very surprised because I was like, oh, it still hurts.
Yeah, and some fun things, they were like, do you want a mirror? Some people, like, they get their higher hopes.
Yeah, when they can see.
When they can see like how much you need to push more so that everything advances. But she's like, help. Help.
No, I was like, no, because I get.
Okay, no bad words, no bad words.
Awesome.
Okay, we're back. We just finished changing diapers
and feeding her. So it's been like what, 40 minutes?
Oh, lovely.
Life of a parent.
No. When she looks at this video, she's like,
We love you.
Daughter number 1. Nah, her name is Sophia. She's behind the scenes filming, so you won't be hearing or seeing her. Well, you might be hearing her.
Yeah. Or her breathing, or sometimes like. We were able to hold her for like an hour and a half right after delivery.
Skin to skin.
Skin to skin.
which you have to pay for it.
Do we? Did we pay?
I don't know. No.
I have no idea. Actually.
I think we just read like you have to pay for skin to skin. I don't know, all that crap. But I guess, was it worth it for you?
Yeah.
If you had to pay, I mean, to pay for it.
Yeah, I think it was worth it. But I think with Kaiser, it's kind of like they call it a golden hour. So I think either way, they will just give you the baby, like that's in there. I guess what they believe in.
I mean, I'm just joking, not trashing about having to pay for that. But yeah, the golden hour, nobody bothers you.
And
You just rest and all quietness in that room.
Just had her with us. They didn't do weight check, nothing. And they said they are not gonna bathe her because the longer she has that white, I don't know what you call it right now.
Layer of natural good bacteria.
Yeah, it's better. So they didn't actually bathe her, but she didn't have that much on her body anyway. Actually, did she?
I think she did.
Really? Oh, I didn't.
I mean, I don't think you will be able to see that, but yeah, I think they said like keep it for 2 weeks, so no shower for 2 weeks, and
So after that 1 hour and a half, they did the weight check, all the checks, right? The heart rate, heartbeat.
Yeah, vital signs.
Yeah,
all that.
basically
IUGR, latching score.
And then we were moved to the postpartum room, which was even smaller. So the labor and delivery room was big actually. But then after I gave birth, we were moved to a different room, and that one was pretty small.
But the difference is the bed, right?
Yeah. They said you don't require that much equipment, and then the bed, it's not like 3 different parts, just 2 parts, and then
so
for
it's
you,
more comfy.
Yeah, I don't know if it was more comfortable, honestly. It
Okay.
just felt like a hospital.
For me, I think the reason why I went to take a nap at home in our king size bed, it's what I had. It was just a couch, I don't know, half of a twin. So, 3/4 of a twin. So I mean, I'm a big dude. So I'm like,
It was squished.
Yeah.
In there. He was squished, and we were there for like 20 hours at least in labor only, in the same room. And after we were moved, actually, a nurse told him that he can pull out the bed more.
Pull out the couch.
Yeah.
And that turned into a twin.
Yeah, I think it was like a good sized twin.
And I'm like, from there, I'm like, okay, I don't need to go back.
Yeah. So after we were moved, we kept having like so many nurses and other office or like clerks checking in all the time. It's like you want to get a sleep, but you really can't, because every hour I think there was someone coming in and checking. And then, when the nurse, the shift changes for nurses, that they come in as well and they talk about what
they
changed.
do their report.
Yeah.
And all that. Yeah. Oh man, super funny. I know it's appropriate.
What?
What is it? Pediatrician.
Oh yeah. You can talk.
I'll just throw it there. She came in. Hi, I'm your pediatrician. Beep name. Blah blah. I'm just here to assess how the baby's eating, latching, and then what was it like? Can you show me?
Yeah.
And then she was looking. I'm like, oh, the baby's not latching that well.
Yeah.
Did she say like, here's how you do it? Or?
No.
Okay. Oh, the baby's not latching well. Okay, bye.
Yeah, she just like ran away. Like she even told us before she started, like she's not good at breastfeeding too when she started with her babies, and she did also have troubles with it. So I guess it brought like memories or something for her.
Memories?
Yeah, because she was like running away from our room.
Yeah, that check was like 5 minutes or less. It was just so funny.
Because usually they discharge you after 24 hours, but since she was diagnosed small and she wasn't latching that well, and I didn't feel comfortable going home with the breastfeeding yet, because I was still learning how to latch her and everything. So we decided to stay one more day, just for her sake too, and for me to learn or do better with the breastfeeding. So we stayed 2 days. So we were discharged on Monday. In the morning, actually, we couldn't wait. We were like, okay, can we?
I think even on Sunday we were like, can I get discharged in the afternoon?
Yeah.
It was, I don't know, it was just like 40 something hours in that little room. I mean, I know they care about the well-being of the patients, but we're like, or I was like, okay, we'll learn by the day and stuff like that. But it was helpful.
Yeah, it was
at
actually
the end
very
that
helpful.
extra day. So just wait as seeing, yeah, you'll be comfortable. Just be one more day. Just make sure everything is fine. And after that, you'll be at home every day, and you might be like, I want to go out again. So just be patient, guys.
Yeah, I definitely think that one more day helped us a lot, especially with latching, breastfeeding, and also they gave us more tips, I feel like, too, talking about.
Yeah. Some of them were very knowledgeable, really helpful.
Yeah, and the nurses are very passionate, actually, and very caring about the babies and the moms, too. So it was really nice. I definitely recommend going through Kaiser. Like, I mean, our experience was great.
Yeah,
with everything. Yeah. And they gave us a gift too. It was our experience. First time parent. It's tough. I don't think nothing can really prepare you for the labor either. Like, I watched so many videos and even took up so many classes, but it was still so different, and everybody's different. Like, for me, the epidural didn't work, which I thought it's guaranteed that it will work for everyone.
Yeah, like the classes are one thing, the online classes, and then the other thing is like being there and doing it yourself.
Yeah,
totally different. And then the people there, they also show you their own experience, what worked and what didn't.
Yes, and I feel like having a good support person and the personnel, like the nurses and midwives and doctors, is very important, actually, how they make the whole environment. Because all the nurses that we talked to, they were like talkative and very fun, and they just gave us lots of tips too. Which was really good, right?
Yes.
Anyway, I guess that's it. It's been like almost 2 weeks since you've been home?
Yes, it's been 2 weeks, I guess. So yeah, we'll be doing random vloggings.
Yeah, we'll be definitely vlogging more because we want to keep the memories of the baby and for my family as well.
We'll be reviewing our little stroller.
Some baby products maybe that we've been using or that we don't use that much.
What's working and what's not working for us.
So thank you. Yep. Thank you so much for watching. If you have any questions or comments, you can
ask her. Not me.
In the comments below. I will answer any of the questions.
Yeah. Guys, feel free to ask the questions too for your wife or for your partner.
Yeah.
Don't wait for her to ask the questions. Be nice.
Yeah. Michael can definitely give some tips too for being a good support person. Because even the nurses were saying that he was a great doula. They call him doula, actually. Really? Yeah. Doula is like the person that you hire to help you through the whole labor.
Did you know I have more certification doula?
True. But
nah.
No, not really.
Nah.
But he was great, and even nurses were like, wow, you were a great support person. So if guys, you have any questions or any daddy related or parents related questions, because I think we'll share some of our tips or tricks or what we encountered so far with the baby.
Yeah.
Bye.
Bye.
See you in the next one.
Bye, Sophia.